Welcome, everybody. This is the Cancer Prevention and Wellness program. We'll get started in a couple minutes. So welcome to June's edition of the Cancer Prevention and Wellness series. I'm Jeff Jaguar, and representing the Cancer Survivors Park Alliance, who sponsors these monthly programs. We're very pleased to have as our special guest tonight, Dr. Robert Siegel, who is the medical director at Secours St. Francis Cancer Center. He's also on the American Board of Internal Medicine Board of Directors, who is responsible for certification exams and recertification exams so that our physicians and subspecialists are constantly kept or meant to keep up to date with the scientific data-driven data that's out there, not the misinformation. Tonight, we're going to be talking about the information age, which also has been countered by the disinformation age. This has become a social problem. It becomes incredibly difficult to navigate healthcare, and especially a subject as difficult and as emotionally challenging as cancer. But Dr. Siegel is going to explore what we can to sort out the claims and try to find some useful information for us to use. Before Dr. Siegel gets started, just a couple of housekeeping things. Those that are on the call will be muted throughout. We do emphasize that we want to hear from you via the chat option, from the standpoint of asking any questions for Dr. Siegel, and we'll be monitoring that, so please do not be shy. This session is also being recorded and will be in about 24 to 48 hours on our site at the Cancer Survivors Park, which is cancersurvivorspark.org. And there, if you miss something, you can relink to it or pass on the fact that there was a very interesting lecture that somebody else ought to be aware of, so that they can go to that site and click on there and get more of this necessary information out to more of our people. So hopefully you'll use the chat option for questions. But now I'm going to turn it over to Dr. Siegel. And again, Bob, can't thank you enough for being here with us.
All right. Thank you, Jeff. It's my pleasure. And welcome to everybody in this virtual world of ours. I am going to spend the next half hour, 40 minutes or so talking to you, as Jeff indicated, about medical misinformation. This is something that has been an interest of mine as a social and psychological phenomenon, almost from the point that I began my career in oncology. So let me show you a little bit what the plan is for the day. And I'm going to start off with an anecdote, a personal one, that initiated my interest in some of this. And then I'll talk a little bit about a brief history of medical information through the years. And it is particularly striking how even decades, if not centuries ago, some of the things that promoted medical misinformation were still operative now as they were then. Talk again, specifying a little bit about the issues of medical misinformation in cancer care. Spend a bit of time talking about why now? Why so much? Why are we so inundated with all of this? I think many of you will probably have a sense of where I'm going to go with that, but this is a particularly critical time for dealing with these issues. And then finally, ending with how you can be a better educated consumer and how you can interpret information that comes to you. So my anecdote is the following. For those of you who aren't familiar with medical training, we finish college, we spend 4 years in medical school, and then start, for those of us who go into oncology, do 3 years of internal medicine training, and then another 2 or 3 years of hematology and medical oncology. And I was at a point in my career, my first year, actually my first week into my fellowship in medical oncology, when I was called to the emergency room to meet a patient for the first time. This turned out to be a gentleman in his 30s, unfortunately, who had spent many years with a progressive type of tumor called a sarcoma, had been through multiple chemotherapeutic regimens, and unfortunately, there was not much that conventional medicine could do for him. His family took him to Mexico, where he was given a therapy that was called either the Greek cancer cure or the Alivizatos cancer cure. And they were told specifically that he should not have any chemotherapy or be exposed to any radiation for 60 days following their attempted cure there. This gentleman presented to our emergency room having multiple seizures that were difficult to control. And as a result, in an effort to try and sort out why it was he was having seizures, he had a CT scan performed of his brain. And the CT scan showed multiple sites of metastatic disease. And I sat down with his family to explain the very difficult situation this young man was in. And his mother became irate and told me specifically that, of course, he now had disease in his brain because I had put him through an X-ray, and he had been particularly told not to have any X-rays after getting this cure. It was a twist of logic and belief that, because very clearly the CAT scan had not caused this man's problems. He was seizing before he came in, and CAT scans don't do that. But nevertheless, this was a source of tremendous anger, upset, and from my perspective was one that really showed just how someone can get wrapped up in a series of false and incorrect beliefs. So just a brief discussion about Dr. Alivizatos, because this was the start for me, and his quote unquote cure is one that you can still find on the internet. And I am talking, my first year into oncology, we were talking about 1987. So you can still find this stuff. What I'm showing you comes right off of the internet right now. This is the description of it, vitamins, minerals, amino acids. None of these have cancer curing properties. There are some buzzwords in here: non-toxic, non-biologic, non-specific, no adverse side effects. It cures everything. We have seen significant benefits for diabetes, arthritis, emphysema, other autoimmune diseases. Here you go. This is what I still promulgated out there. Radiation and X-ray should not be prescribed during or within 60 days after the treatment, as they are deleterious to the Olivizatos treatment. And this is the website that this all comes from. So this is not from 1987 when I first saw the patient, but this still exists on the internet, and there are still institutions that promote this therapy available in the United States.
So, Bob, are there any deterrents? Are there any consequences to the people that promulgate this information? And obviously, he didn't have a curative option, but he was told he had one. And so one of the ingredients, obviously, is that you have to have a desperate situation for people to believe. But have you ever had anybody that suffered any quote physician that suffered consequences for espousing the virtues of something that had no scientific backing?
Not as much as one would think. The person that I think of, and Jeff, you're probably familiar with this as well because we're of similar vintage, but there was a Dr. Brzezinski in Houston who promoted anti-neoplastons.
Right.
And he was sued multiple times. And I think ultimately, but most of this is civil stuff. It's not criminal stuff.
Right.
And individuals have to be inclined to go through the process. And this has been around for quite some time. I mean, this is a classic picture from the 19th century, and what I've quoted there is a paragraph from the 1700s. But this is how medical cures were touted. You notice the very important guitar and banjo that needs to be part of this this showboating. But it was hucksterism. It was attempts to deal with desperate people and provide them with something that they felt they needed, and they needed to be convinced that they needed. And again, from the past, there is, up in the upper right-hand corner, Dr. Chamley's cancer-specific cure purifies the blood and removes all cancer virus from the system. A lot of this is based on stuff that sounds like it's very scientific, but it frequently is not. And it's not just for cancer, it was for virtually everything. And this is the the snake oil that you hear about, the snake oil salesman. Well, there was snake oil that was touted for virtually everything that ails you. So it's again, under the cancer cure, it is the only remedy that has ever been discovered to cure cancer in the blood. And this was one of the more recent ones. This gentleman whose name I have promptly forgotten was promoting the pH miracle, that if you could somehow adjust your pH in your body, that is the answer for curing cancer and filled a book with the information about that, labeled himself a PhD, which he was not. But the fact of the matter is that our national organization, ASCO, the American Society of Clinical Oncology, in 2018, published a study regarding alternative medicine and certain misconceptions, and 4 in 10 Americans believe that cancer could be cured solely through alternative therapies. I hope I'm not offending anyone out in the Zoomosphere here, but the fact of the matter is that that isn't true. And 38% of those folks were caregivers, and 22% of them were people who actually had cancer. And the younger you were, the more likely it was that you would hold these beliefs. So just a little bit about, Dr. Jaguar asked about consequences, and when we talk about self-regulation, you will find that some of the pushback against self-regulation has echoes in current time. When the United States was formed, there were only 2 states that had any licensing laws for physicians. But by 1830, there was an attempt to provide some professional societies an oversight of medical care. And in that period of time, virtually all states had developed licensing laws. How did that licensing work? Well, it was a combination of examining boards from the states and state medical societies. Some medical schools determined who would get licenses, but there was never any, at least at that point, national process. And what would you do if there were, if you practiced without a license? Again, that too was variable. The penalties were administered by medical societies, maybe. Sometimes there were fines, and most states just gave verbiage to the fact that they wanted to ban quackery, but there were no consequences necessarily. By about 1850, however, every attempt to provide any kind of oversight of medical licensing had largely disappeared. And if you look at a survey of Tennessee people who called themselves doctors, there were 201 people who called themselves physicians. 35 were graduates of school, not medical school, school. And more than 50% had received no instruction other than reading on the topic. So why was that? Well, one was the fact that that there developed these organizations that provided bargain degrees and diplomas to individuals who wanted them. This second thing is a little bit true today. There's a suspicion that, okay, well, you have a monopoly in who died and made you king, and it's just an opportunity for you to charge whatever you want to charge. And that there was a suspicion of elitism, that somehow your learning could be used to exploit people who didn't know as much. And finally, within the legislature, there were a sense of that from legislators that people ought to be able to choose what they wanted to choose. And if something was out there for them and they felt that it was the right thing for them to do, that anyone who had something to offer can and should be allowed to offer it. So, so this then also gets a little bit into the fake news issue. What can you put out into the public, and who controls it? And so you see here the term fake news used in an article that was published in 1925. So it this was not necessarily about medicine, this particular article. It actually had more to do with finance, but the notion that somehow information can and should get disseminated using our streams of media was an issue back in 1925 as well. So this is where the concept of medical misinformation overlaps with some of our information about or understanding about fake news. Because medical misinformation is fake news, and it gets disseminated in the same fashion that our political fake news gets disseminated. So to the extent that we understand some of our political fake news, we can understand a little bit about our medical fake news. And so what I've listed here, not necessarily in any order, I've tried to be politically agnostic here and promote both, or not promote, but to mention both some of the left's and the right's attempts at misinformation. Not intending to offend anyone, but the fact of the matter is, none of these things are true. None of them are true, but they have all found their moment in the sun, some of which still have their moments in the sun, because people promote them, but on the other end, people accept them. And I think that's an important part of this. It's not just the fake news promoter, it's the fake news recipient as well. And when it comes to medical information, it is not just the quack or the individual with incorrect medical concepts, but it is also what is going on psychologically with the public that makes it so vulnerable to these bits of information and to falling for these claims. And we start off with the notion that the internet is a source of truth. It certainly can be. I'm one of those people that thought when the internet became more prominent, because I lived through a life without internet and smartphones for a good portion of my life, that the internet would be a way of educating everyone and providing truth. And in fact, even though it does do that, it does just the opposite. And I am concerned that really the opposite is true. So what makes misinformation on the internet so effective? And there are two basic concepts here, but there are many sub-concepts. One is our polarization of the public. I don't think there's anyone who would deny that at this point in time, we are at each other's throats in a way that I can't remember, except perhaps in the 60s. It is an unfortunate consequence of our current life that people who don't agree with you tend to be perceived as an enemy. And then there's also the changes in media that tend to make individual facts allow individual facts to spread like wildfire. And again, what's true for political misinformation is also true for medical misinformation. So what is the polarization? What are the implications of polarization? Well, I'm going to get into a little bit of psychology here, but the psychologists will tell you that when it comes to believing things, we will all have a tendency to accept at face value claims made by our party leaders, friends, and other like-minded media sources. There is just a general sense of suspending disbelief when there is someone that we perceive to have similar thoughts to ours says something. And also, a related concept is that if we hear something that tends to bolster our own life beliefs, we will tend to be more inclined to accept that as truth without research. And these things have consequences. You know, in Iran, there was a period of time when methanol was thought to be a treatment for COVID-19, and there were nearly 1,000 deaths from drinking methanol. There was an herbal remedy that didn't have any consequences that I'm aware of in Madagascar, but certainly did not, it prevented people from getting a more appropriate therapy. And there were people who took the whole question of internalizing disinfectants as a means of curing COVID that became significantly ill. So this is not, it's not a moot point. That misinformation, if you happen to believe something that's not true, that it's harmless. When it comes to health, it can be quite harmful, either because what you're doing is directly harmful to you, or by doing it, you avoid something that might be able to help you. So what about technology? Well, on the bottom here is a picture from 1916 of people getting their information. And on the top is 100 years later, people getting their information similarly aligned. Now, the getting the information part's about the same, but what those people are doing with that information in the top picture in terms of liking it, sending it to someone else, creates a whole chain of events that engages large numbers of people in ways that newspapers never could in 1916. And just comparing digital encyclopedias versus analog historic encyclopedias, you get a sense of how much information there is, how many people are subscribing to it, how many people are interacting with it all across the world. And so we are dealing with a much different animal when it comes to the spread of any information, whether it's fact or fiction. And so just again, getting back to what the internet can do for you, the internet can be a source of many truths, but you can be certified in all kinds of things. So if you want to be a master of mangoes, Sell More Mango can do that for you. That is something that can be attained from the internet, but it's also the place you go to learn about cancer therapies. And this is from the sublime to the ridiculous, but the fact of the matter is there's everything in between. And if Mr. Pavlovic can obtain his Master of Mangoes, you can also obtain sort of mango level information about your cancer from the internet or your other health problems. So buyer beware. And the part of the problem is that fake news and medical misinformation has become significantly more sophisticated over time. I think, at this point, people could read the Weekly World News or the National Enquirer and realize what it was. It was titillating, it was satire, it was hoax. It was the rare person who believed that Hillary Clinton actually adopted an alien baby. However, our technology and our photoshopping and our ability to create these deep fakes now have the opportunity to put out there pictures that are plausible. On the top is a picture that never happened with Donald Trump arm in arm with the Ku Klux Klan, whereas on the bottom, there is a picture of a woman tearing up the Constitution, which in fact really was, and it was really actually an anti-gun ad when it's a person tearing up a Target. But someone has taken the original intent, manipulated it to create a point that, quite frankly, was never really made. So context is important and technology is important. So what have I seen through the years? And well, I talked to you about Dr. Olivizatos, and I happen to mention anti-neoplastons. People were pursuing, diet has always been an issue, but the macrobiotic diet, when I was early on, was a diet that caused people to lose enormous amounts of weight in their efforts to sort of purge their bodies. Laetrile, shark cartilage. Shark cartilage was promoted on 60 Minutes as a potential cure. That's how insidious some of this is. I mentioned the pH balance. You will hear people talking about glucose avoidance, and there are dozens that I have left out here. SEACT. If you look, you'll find them. I just wanted to create a handful here because they certainly do exist. Many of these types of therapies are associated with institutions of one kind or another. The shark cartilage thing was ultimately debunked only after there was a clinical trial comparing it to conventional chemotherapy. So, if you look at, cancer misinformation research, I showed you a little bit of it that came from FASCO, and this is from the National Cancer Institute, which looked at information on Facebook and other social media. This was about 3 years ago. Reviewed the 50 most popular social media articles on the 4 most common cancer types. It was prostate cancer, lung cancer, breast cancer, and colon cancer. 32.5% of the articles contained misinformation, information that was just wrong. 30.5% of them contained harmful information, which if you followed would actually hurt you. Of the ones that contain misinformation, that's where you found most of the harmful information. And this is the other interesting thing, is that the ones that contain misinformation or harmful information were engaged by potential readers 50% more times. If you look at a conventional article about conventional therapies and you compared it to one that was clearly involved with medical information, the medical information was clicked 50% more times than the factual articles. So why do we hold these beliefs? Well, to be truthful and to not try and be elitist, but I will sound that way, I think there's a lack of information literacy, particularly about science, and we'll talk a little bit about that. There are cultural factors, some of which I indicated to you, that our shared beliefs are exacerbated by our polarization. If someone says something that you feel an affinity to, you're more likely to believe it. If someone says something that you think politically or otherwise is an idiot, then anything that comes out of that person's mouth is unbelievable. There is an inherent problem with establishment healthcare that runs through our society, and trust me, there are some of us who are physicians who have some difficulty with, the healthcare industrial complex. But there are suspicions about the pharmaceutical industry that are out there, and many of which are well-founded. The other thing is that the social media algorithms, if any of you have ever shopped for anything and find ads popping up all over the place about whatever it is you just shopped for online, you know that you are going to be presented with things that engage you. So if you show yourself to have an interest in a certain bit of information, medical information, Facebook and all of the other social media will inundate you with more of the same. So you don't have an opportunity to necessarily see or hear, in terms of what you are fed, contrary concepts. There are emotional factors. A lot of these concepts that fall under medical information promise your self-reliance. You control this disease. The disease does not control you. You can cure this disease. And then there's our own inherent reasoning. I'll talk a little bit about fast versus slow reasoning in terms of accepting versus not accepting certain facts. The tendency for all of us to believe the first opinion that we hear. We want to believe in good news. If somebody provides medical information that says, this is going to be good for you, this is going to cure you, this is going to make you well, especially if you're in a situation where you want to be told that, you're going to believe it. And then there's concluding causality when none exists. So-and-so did this, and this ultimately happened. Was it because, did A cause B? A lot of times people will draw conclusions that is in fact the reason, when in fact is not. And the two events were not related at all. So again, this fast versus slow thinking. So fast thinking is, somebody just threw a baseball at your head, your hand goes up, you protect yourself, you flinch, you do a number of things. That also works with our thinking process. When we hear something that we want to agree with and we make a judgment that we agree with it, and it's impulsive, but it's also tends to be, it doesn't take a lot of effort and can be error prone if you don't think it through. It's just, how many times have some of us done something because we're angry and then thought it through and said, yeah, maybe I shouldn't do that. Oh, or maybe I shouldn't send this email when I'm angry. That's fast versus slow thinking. Slower thinking is more logical, rational, rule-based. It takes more effort. And it's that effort that sometimes gets in our way. If something feels comfortable to us, we want to have that be the truth, when in fact it may not be true at all. So what about the scientific literacy? Sometimes it's hard. In order to understand some of the science related to cancer or any other disease, you have to understand the rigor that goes into the scientific method and the efforts that we all make to make sure that what gets promulgated as science is in fact well vetted and true. It makes it slow. It makes it sometimes indecisive when we're looking for finite and definitive answers, but it is the nature of science. So we all need to understand a little bit better what the basic concepts of cancer and how it develops and grows, because if you don't understand that, then you don't understand the treatments. You have to understand that to understand how the treatments work.
So in your overall itinerary, you're now getting into the aspect of how to differentiate, giving people the tools to figure out, whether this is too good to be true or good. We just had a chat question from a gentleman who has rectal cancer, very near and dear to his apart from the family standpoint, heard something on a reputable radio show about some new therapy for rectal cancer and wants to know how to vet that. So hopefully that's what we come to now.
Yeah. So I will answer that. I'll go through this slide here and then answer that specifically, because that is not medical misinformation, so to speak, but it is medical information that gets disseminated without context. And the truth of the matter is, our news outlets want to provide us with good news stories.
Right.
And our physicians who do the research are just as interested in promoting good news stories and promoting their careers. Right. So, so let me just going through this, the knowledge about science in general, how we do research, how we have to have consensus, how we have, you know, the notion that there is a conspiracy to do almost anything in science is virtually impossible, given the number of people that are involved with the development of a concept in disease. You can find individuals who promote bad ideas, but the notion of conspiracy with vaccines or conspiracy with, you know, the rollout of a major initiative, that is almost impossible to do. And science has to be valued as a way of understanding the world. I value my plumber and my electrician because they have skills that I don't have. You know, I value others who are professional sports figures because they have qualities that I don't have. And I think society at large has to understand that there are some people who in fact study medicine, study science, and this is what they do. And the competencies involved is learned over many years. It is not a do-it-yourself project that you can pick up from Google. So getting back to this, there was a study that came out of the American Society of Clinical Oncology, which is what I'm sure the individual is referring to, in which every individual who got this particular drug, who had been treated for colorectal cancer, responded to it. And that basically is the message that gets out, but it is not the complete message. And that message actually gets tempered by the fact that these were very select individuals who had a particular genetic marker that is found in a minority, but a very real minority of individuals who have colorectal cancer. The vast majority of people who had colorectal cancer, however, would not have qualified for the project and would not necessarily have had the same kind of response as this very select group does. Now, for the individual who had asked the question, I would imagine that your oncologist probably knows the answer to this question as to whether or not that genetic series of findings is pertinent. And if it is, then this is an excellent drug or an excellent class of drugs for one to potentially get as part of therapy. But again, the message gets delivered because it's a good news message. It was a study, however, in a very limited number of people, and there was a certain context that either got lost in translation or was not necessarily promoted as importantly as the good news story.
Right.
All right. So how can you spot a fake? Now, I wouldn't call what I just spotted a fake, but it's
not the whole story.
but it's not the whole story. So read the whole story. Don't share or comment something without knowing what the article really said. And if you have questions about what the article really said, that's what your physicians, caregiver, navigators, professional staff are for. Check the author. What is their background? Are they somebody who should be commenting on something with that degree of expertise? Look at the date. Dr. Olivizato's information, although present in 2022, goes back to 1989. And I don't know that Dr. Olivizato has cured many people because we're still dealing with cancer as much or more as we had in the past. Think about the image that you see, like those doctored images we had seen before. Fact check what you see. Is this something that's just in this location that I'm looking at, or can I find this in other locations? What's the source of the website? Is it something that, are they looking for funding? Are you having to pay something to get get the benefits that are promoted? What's the reason for the article? Will they be collecting your personal information? That's the other issue, is to draw you in and then have you give personal information, medical information, perhaps some identifying information that's used for other things, and in terms of identity theft. Is it written well? Historically, many of these things were not written well at all. And finally, to make sure that it's not satire. Some things are just out there just as a bad joke. So what are the other red flags? The use of testimonials rather than data. What does that mean? Well, I had cancer and I took thus and such cure, and now I don't have cancer anymore. A series of individuals rather than a study of X number of people who received drug X compared to conventional therapy, and the people with drug X are doing far better. That's a research study. Anything that touts a miracle cure, doesn't have any side effects, or is against big pharma or something like that, that's a red flag. Asking you to purchase something directly from the website. Does it intend to frighten you or ask you not to listen to your doctor? And then finally, promising universal great results without any disclaimer of difficulties. And again, if you go back and you look at my look at the stuff from Dr. Olivizato's website, the first thing I put on here, you will see all of these things in that website. It is a classic example. So finally, I just wanted to finish up with, again, the self-regulation. As Jeff told you, I'm a member of the American Board of Internal Medicine Board of Directors. We take certification very seriously, and we expect and take that certification as meaning something not only to the doctor, but to the public. And if that doctor is certified and is promoting misinformation, that is a serious concern to us, and it's something that we have grappled with for the past year, especially during the COVID pandemic. The Federation of State Medical Boards several months ago issued a statement saying that the state medical boards would remove or rescind the licenses of physicians that are promoting misinformation. And the American Board of Medicine has decided that we too, if so prompted, will take on the possibility of removing the certification of an individual who is promoting medical misinformation. Now, that doesn't make this an easy task. What constitutes medical misinformation? And there are degrees of medical misinformation, and clearly I think we are only going to be looking at the most heinous and potentially harmful misinformation that's out there to potentially remove the certification. But we have already had physicians who have been reported to the ABIM as promoting misinformation, both from patients and from other physicians, because we all recognize that physicians who are certified in the same way we are, but promoting misinformation, are polluting the waters. And they're making medicine untrustworthy, and they are putting people at risk. So if you have a minute, you may want to just take a look at the last series of quotes, which comes from the perspective article from the New England Journal of Medicine, which was published a few weeks ago by my colleagues in the American Board of Internal Medicine, and why truth is so important in medicine and in dealing with the consumer. And I think that is my last slide. And Jeff, I hope I did not go over time.
No, I think you did great. It's been one of the most informative discussions that we've had. And to those that are viewing or listening, just want to make sure that if you feel likewise about this, I'm just looking here for we got something else in here for the chat. A tiny group of people with rectal cancer just experienced something of a miracle. Their cancer simply vanished after experimental treatment. In a very small trial, these patients took a drug called dostarlimab, sounds like immunoregulatory drug, for 6 months. And in the end, every one of them saw their tumors disappear. Small, just 18 people. That it sounds like there's something potentially to be learned from that. But again, you have some of Dr. Siegel's rules for the road as far as determining whether or not this was a truly selective population, and it probably was. And was it a balanced, controlled study? So this is also a place where we can tell.
Jeff, Jeff, that is actually I'm sorry to interrupt, but that is the study that I was looking at. And for you and me, getting in the weeds, that was only for microsatellite unstable patients. And so, a small percentage of patients with colorectal cancer. Trust me, it's very exciting. Immunotherapy of that type is one of the revolutionary things that has happened to medicine in the past 5 to 10 years. And I do not want to be perceived as demeaning the results of that trial. It is what keeps us going. But the problem is potentially universalizing the results of that study to everybody when that study was not open to everybody. It was a very select population.
And to throw another wrench into that, it has been historically the case that many scientific medical advances have been started by physicians, scientists who were basically labeled as quacks by the medical establishment. Again, we come from the same era, and we initially in our training saw a lot of radical mastectomies, and over the course of our oncology careers, there was a gentleman by the name of Bernard Fisher who basically took us from a Halsted radical mastectomy to a modified radical mastectomy to a lumpectomy to sentinel lymph nodes. And all of that was done via clinical research, doing what we did before versus trying something new. We espouse the virtues a lot of lifestyle medicine here. And, one of the fathers of lifestyle medicine and cardiology, Dean Ornish, he got a lot of negative feedback from the cardiology establishment about, taking lifestyle and seeing if he could reverse coronary artery disease too. So, there's some new concepts and new thoughts that sometimes we have to really experiment with rather than dismissing them out of turn.
Agreed.
So again, those people who were listening and enjoyed these comments and feel that other people could gain some insight from these, please share that. Again, that'll be on the cancersurvivorspark.org website. As is usually the case, we end with some kind of a quote. This one's a little bit longer. It comes to us from Howard Zinn, who was an American historian, playwright, philosopher, and it's called A Marvelous Victory. To be hopeful in bad times is not just foolishly romantic. It is based on the fact that human history is a history not only of cruelty, but also compassion, sacrifice, courage, kindness. What we choose to emphasize in this complex history will determine our lives. If we see only the worst, it destroys our capacity to do something. If we remember those times and places, and there are so many, where people behave magnificently, this gives us the energy to act and at least the possibility of sending this spinning top of a world in a different direction. And if we do act in however small a way, we don't have to wait for some grand utopian future. And the future is an infinite succession of presence. And to live now as we think human beings should live, in defiance of all that is bad around us, is itself a marvelous victory. So thank you. Our next Cancer Prevention and Wellness will be July 14th. We will have a speaker from Columbia University talking about integrative medicine and the reason for it as it complements conventional medicine. Dr. Siegel, thank you for your time and thank you for your energy in putting all this together and for your delightful comments. Thanks.
I appreciate it. Thanks for the opportunity.